Gina, so we're going to do your first treatment challenge, if you will, for laser low back care. Tell me what level of pain you have that's in your lower back. Number 1 today. 0 is none, 10 is the worst. Where are you at today?
I would say probably a 6 or 7 between them.
Okay, 6 to 7 out of 10 right now. All right. And is there any particular movements that increase the pain for you? If there's any movements one way or the other?
Definitely leaning back more, and then like, yes, leaning back, and then like when I was on the bed,
laying
Wednesday,
down,
like pushing up, like
okay,
to get my back up.
It's kind of like so right now, I'll have you turn to the side, like this right there. You're good. Now, if you go to lean back, when does that pain kick in for you?
Right now.
Oh, like right away.
Yeah.
Okay. And what level of pain does that? Does it increase the pain right there?
It first starts off.
It starts right off.
It starts pinching, and then it turns into that pinch, and then a little bit of pull on this side. So it's more going to be on the right side, and then it's that pull. Yeah. And then when I go farther back, then it gets to that pinch.
Does it? Okay, so it increases further. What's the highest level of pain as you're going back? Does it go up from a 6 or a 7?
So right now, it's probably that middle 5.
Okay.
And then it goes to 6, 7 right now.
Okay.
Right there.
Right there. Okay, boy, that's not much movement. Okay, and if you bend forward, what happens when you lean forward?
I honestly feel like I'm getting the release.
Okay, so a little better going forward.
Yeah. It feels like I'm not, because it feels like that stacking and then that pressure on that back of that disc.
Excellent. Well, let's do your first session. We'll see how you do. I think you're going to do great.
Well, I'm excited.
All right, awesome. We just got done with your first laser session. How did you feel while you were sitting in the session?
At first, I felt like I was stiff.
Okay.
And then when I was starting to focus on my movement, I was noticing that I was able to move a little more.
Okay, excellent.
But I don't know if I was moving too much because I was worried about moving or...
That's all right. No, it's great. What's really cool about the lasers, we can encourage some movement while we're doing the session so it can be comfortable. So tell me how your pain level is now.
So right now, I think because like I was saying, like I feel more mobile. Like I feel like because I was moving, I feel like I can move and it's not like, oh, stop. There's that shooting pain.
Good.
So I do see like that pain is dropped to either a 4, or a 3. Definitely, I'm not like, oh, hold on here,
Awesome. So you were a 5 or a 6 before, and now you're like a 3 or a 4.
Yeah, and then pushing it probably a 7, and like just now going like this, I just feel relaxed. I feel like that movement and just. Moving kind of woken up those muscles or ligaments, if you will.
Sure, lots of things happen.
Yeah.
Okay, good. So when you go to lean back right now, Gina, tell me what you feel when you lean back right here.
It just feels like a stretch, like a deep stretch.
Okay, yeah, definitely. You have more range of motion that way. And when you bend forward, tell me that feels still comfortable for you going forward?
Yeah, that feels like a release. Like,
that's still the release you had.
Like doing that stretch, it feels like all of that release on the spine.
That's great. So that's somewhere between a 30 and a 50% change.
Yeah, I would say.
In one session. So.
Yay!
Awesome. Good for you.
And then I was thinking if I want to pursue it more, then because I have really problems with my foot and those stiff ligaments. And so maybe it might, because I was thinking.
There's an FDA approval for plantar fasciitis and foot pain, so we'll talk about that.
Okay, well, cool.
Okay, awesome.
Well, great. Thanks.
Yeah, thank
Appreciate you.